मेरी आवाज आ रही है आप सबको? हेलो एवरीवन, एम आई ऑडिबल? वेलकम सर। सो स्टार्ट करते हैं फिर अभी। ओके। हेलो सर, हेलो मैम। नालंदा एकेडमी की तरफ से मैं आपका स्वागत करता हूँ। तो ओके, सो मैं आपको थोड़ा सा, जितने भी हमारे पार्टिसिपेंट्स हैं, ठीक है, मेरी आवाज आ रही है सबको? ओके, चलो। तो आज हमारे साथ जुड़े हैं अपूर्वा सर और निमिषा मैम। इनका जो है पब्लिक हेल्थ में मास्टर ऑफ पब्लिक हेल्थ में सेंट लुइस यूनिवर्सिटी से इनका पीजी हो चुका है। ठीक है। तो आप सबको पता है कि पब्लिक हेल्थ एक ग्लोबल इशू है और कोविड के बाद इसका इम्पोर्टेंस और ज़्यादा बढ़ चुका है। तो इसी के बारे में आज हम बात करेंगे। सर और मैम अपना एक्सपीरियंस शेयर करेंगे, हमें बहुत सारी बातें बताएंगे कि क्या पब्लिक हेल्थ के रिलेटेड जो भी करियर प्रोस्पेक्टस है या फिर रिसर्च से रिलेटेड है, इनके बारे में आज हम जानेंगे। तो स्टार्ट करते हैं। ओवर टू यू सर।
Thank you, Jayesh, for introducing us so well. हम अगर इंग्लिश में बात करें तो चलेगा क्या?
हाँ,
क्योंकि इसमें थोड़े टेक्निकल टर्म्स हैं जो हिंदी में एक्सप्लेन करना थोड़ा मुश्किल है, तो हम इंग्लिश में बात करेंगे।
Yes,
अगर किसी को कोई डाउट होगा तो चैट में पूछ लेना।
बिल्कुल बिल्कुल।
ओके, तो स्क्रीन शेयर करते हैं। Okay, so thank you everyone for joining us for this session. So we will be discussing about public health in United States, our experience about public health, learning about public health in United States, and we will be able to tell you a little bit about PhD if you have any questions, but mostly we will be talking about studying masters in public health. So this is me. My name is Nimisha, and I did my bachelor's in dentistry from Government Dental College, Mumbai. And that was back in 2009. I finished it in 2014 and got enrolled into Masters of Dental Surgery in Prosthodontics at Government Dental College, Aurangabad. So that went from 2015 to 2018. And because I was in a government college, I had to sign a bond to serve as an assistant professor for a year. So I served as assistant professor at Government Dental College, Mumbai, again, which was my bachelor's college. And that was for a brief period because I then got enrolled into a fellowship program at Tata Memorial Hospital. That was in 2019. So this fellowship was in prosthetic rehabilitation of oral cancer patients. And I used to provide oral cancer patients who had undergone surgery of the either the upper jaw, the lower jaw, or any part of the face. I used to provide them with an artificial thing like a prosthesis to cover that up so that they can go out in the society and look normal and talk in a normal way. So that was my work there. And looking at the conditions of the patient, looking at what stage the patient, at what stage of cancer the patient came in to the hospital, and since they had to undergo such like a life-changing surgery, I was moved by those things, and that increased my passion about looking at the health indicators of our society, of the marginalized communities especially. And I thought going for a public health degree will be a good thing, and I will be able to do some research and also work in healthcare programs in the society that could uplift the health of marginalized communities. And that is why I pursued public health, Master of Public Health. That was my second master's from St. Louis University. So it was a joint concentration of global health and epidemiology. We will talk about these two fields later on. So I completed this from St. Louis University and I just graduated in May. Thank you.
Good evening, everyone. So my name is Apurva, Medhe, and I have done my Masters of Dental Surgery in Oral Pathology from Government Dental College, Aurangabad, in Oral Pathology. And I also served as an assistant professor for a brief period at Government Dental College, Nagpur, before enrolling into Masters of Public Health program at St. Louis University. I was always passionate about making an impact on larger communities living in low resource setting, mostly the marginalized communities, by improving their healthcare accessibility and health equity. That led to a decision to pursue Masters of Public Health from St. Louis University, USA. So before going into other things, we will see what is public health. So public health, when we say public health, when we say health, we think of doctors, nurses, dentists, but then public health is consisted of all of these things. So it's not when we think of doctors or dentists, they treat patients on one-on-one basis. But what is public health? So in public health, we have to think of larger community and keeping them healthy and safe within community. So it's not about a single person, but it's about a large community and providing healthcare services to all of them. And there should not be any discrimination. Those services should be provided them irrespective of their social background, economic background. So that is public health. So public health involves efforts and action aimed at preventing diseases, promoting well-being and improving overall quality of life for everyone. So when we see the doctors, how they treat patients, so they treat patients' diseases after disease happens. But then in public health, we think of preventing diseases. So it's about preventing diseases, preventive conditions, which are going to affect the well-being of people, and that way improving overall quality of life for everyone. For example, vaccination protect against illnesses, ensuring clean drinking water, responding to health emergencies like we recently seen COVID-19 pandemic, where like communities were affected and there were efforts taken on a larger scale so that all of them can be benefited from it. So that comes under public health. So public health, rather than focusing on an individual, it focuses on entire population. So that is the best part of public health, and that also inspired me before moving towards public health. In public health, we also think of addressing the social determinants. What are the social determinants? So when we think of people affected by diseases, we think of causes of those diseases. So we think of causative organism, microorganism, viruses, bacteria. But then why only specific communities are affected? Why there are health disparities in them? Why they are facing healthcare inaccessibility? Those things are depending on certain structural factors like the area where they live, their economic background, their social background, from what community they come, their caste identity, like the socially discriminated castes like scheduled caste people, scheduled tribe people, and other backward classes people, minorities. So these factors also affect in creating these health inequities or health disparities. So addressing these factors is also important while looking at public health or deriving public health strategies. So coming to the thing that why to pursue public health, there can be different reasons for different people. I will give you my reasons or our reasons. Uh, so uh, so while in India, we have experience of studying and working in public institutions like Government Dental College, and Nimisha worked at Tata Memorial Hospital. So there we could see the patients from various backgrounds were coming, and the patients which were from marginalized communities, underprivileged background, they were facing difficult to access the healthcare services because of the difference in the um, things like technological difference or unable to communicate with people, and also the attitude of healthcare providers was different from what they were expecting, and then it was causing their conditions to deteriorate, and then there were health disparities. Like you can see people from a privileged background or cities, they were feeling comparatively easier to access those services compared to the people from marginalized background. And then there were health programs, there were policies which were there for them, but they were not implemented properly. So there were schemes like government schemes which provide them discount in the treatment, but then they were not able to access it because of the other factors, and those schemes were not implemented properly and not benefiting the people whom it should be benefited. So these were the experiences we had while studying and working in public institutions in India. Then the at, at the receiving end, like the consequences were mostly faced by marginalized communities like scheduled caste communities, scheduled tribe, OBCs, minorities, and so these things were visible to us. But then what clinical field provided us was the first-hand experience of declining health indicators due to ill-implemented public health program and policies. But then it provided us very little knowledge and opportunity about what can be done on a larger scale to improve this scenario. So we did a lot of discussions, brainstorming. We asked different people. We went on online to see what we can do, and we arrived at a decision to take education in public health. But then after taking decision, why USA for public health? So we thought of different factors like how we can learn to change this scenario, how we can take training and education that will help us in changing this scenario in India. So we thought that we should go to some place where we can have advanced education and a different point of view. So we chose United States of America because they have an advanced public health system. If you compare to the public health system of India and US, so US has a better public health system. So that's why that was one of the reasons. Then they're also global leaders in research related to public health. They put a lot of funding, they give opportunities to researchers, and they carry out various researches in public health. And that help us to provide a base to plan a public health program or plan strategies. So to get that exposures to interact with people who are already working in this area, we thought USA can be a good option. Then the next thing was institutions. The institutions in United States, they can provide you best updated knowledge of the field. So if you see Indian education system, most of the times you see that you are studying things which are there from 15 years or 10 years, and you don't see things which are recently been invented or applied to the conditions. But then in the United States, they have this system that they keep updating their curriculum in order to introduce things and expose um, or teach those things to students so that they can learn updated things also and the things which are there previously also. So their curriculum was one thing which interested us in going towards USA to pursue public health education. And then one more important thing, that even if the institute is in USA, their view is not confined to USA. It's not limited to USA. They have a global view. So they will teach you what strategies were effective in Africa when a particular disease outbreak happened, uh, what strategies were implemented in India or Indian subcontinent, how they work. So they teach you about Latin America and also about USA. So you get a global view of public health. So whenever you think of working on some public health issue, you will have a background or background information all around the world, and that will help you to broaden your view, give you different options while thinking about some issue or working on some health project. And the most important thing is getting a hands-on experience. So they provide you internships. Like I did my internship in Missouri Department of Health and Senior Services, where I worked on a oral health project. So also I worked under professor on various research projects while I was studying as an MPA student. So they provide you these hands-on experiences which improve your confidence, and it provide you knowledge and make you a good public health professional when you graduate from those institutes. Yeah, even after that, you need to keep yourself updated, learn new things. But then, yeah, you get a very good base when you graduate from institute in United States. So public health is a huge field and it has many branches. But then we will mostly talk about the STEM branches in public health. One thing which I can tell you why STEM branches are important, because STEM branches provide you a scientific methodology and statistical analytic methodologies. So these things are very important in today's world, because you have big data, and then to get results or to understand what the data is trying to show you, you need these statistical methods, these scientific methodologies, which you can apply, which you can use, and then you can show other people or convince them that, yeah, this is an issue and this is the solution to it. So the STEM branches are usually epidemiology. So in epidemiology, you have infectious disease epidemiology and chronic disease epidemiology. So infectious disease epidemiology is about the infectious diseases. Chronic diseases are like diabetes. So it's about that. I won't go much in detail about it. But yeah, you need to understand that there are two parts, and sometimes it's only epidemiology, which comprises of infectious and chronic disease epidemiology. Then you have biostatistics. Biostatistics deals with statistical methods, statistical softwares which analyzes the data and interpret it and provide us what the data is actually trying to tell you, what the issues are, where should we focus on. So that is about biostatistics. Then environmental and occupational health. It's sometime it can be kept as a non-STEM branch also. But if you see, it has also those scientific methods and methodology and statistical methodologies, which can that way you can consider it as a STEM branch. So environmental and occupational health is where you deal with things like the environmental hazards or the hazards which are present where people go to work, and how to deal with that, how to train people, how to aware them to be safe from that. And the non-STEM branches are social and behavioral sciences, health policy and management, global health, maternal and child health, biosecurity and disaster preparedness, community health, health promotion. So We will talk in detail about them later on, but these are the non-STEM branches. So coming to the STEM branches, I already explained what is epidemiology. It heavily relies on statistical analysis and scientific methodology. So that is one important thing we should understand about epidemiology. Then biostatistics, also I explained. So you know about these three STEM branches. So why is epidemiology designated as a STEM field? Because epidemiologists gather data and analyze the data. They try to understand the disease patterns, causes of disease, the population and trends of diseases, where the disease outbreak is seen, where the maximum cases are there. Like we have seen in COVID cases, where there was an outbreak, like many cases were seen of COVID-19. Those areas were made containment zone. So those all things are studied by epidemiologists. So they understand how these cases are getting transmitted, what measures should be taken on population level to prevent or control the disease, so that disease won't spread to other people. And so yeah, so this is epidemiology. As it relies on scientific principles, it's a STEM field. So when pursuing public health, you can have two options. Like either you can pursue a program which is a Masters of Public Health program, or MS in Public Health, like MS in Epidemiology or MS in Biostatistics. So either way you can go. So there is a slight difference between MPH and MS that I will be telling you. So in MPH program, students learn the full spectrum of public health. Then they also specialize in specific area. Like if you go for epidemiology, you will learn more about epidemiology, epidemiologic principles, epidemiologic methodologies. Then there you can enhance your research skill and also gain experience through hands-on work in public health field. You also have to work on a capstone project. So capstone project is a project where at the end, in the last semester, you will be assigned to a project under a mentor, and then you will go through the project planning, development, and then carrying out the project, then interpreting the data, carrying out statistical analysis of the data, and then putting your results, documenting your results. So that is a capstone project. So it gives you a good experience of how the overall research looks like in a real world. Then MS program is mostly focuses on enhancing research skills and knowledge to work on research related to the field of biostatistics. Mostly MS programs are MS Epidemiology or MS Biostatistics. So they focuses on particularly on biostatistical or epidemiological principles. They don't provide you the other experience of other areas of public health field. So MPH overall gives you all the information about all the fields, like introduction of those fields. But then MS will focus on that concentration which you select, like MS Biostatistics or Epidemiology. And there are some students who have also received scholarship for MS in Biostatistics or MPH in Biostatistics. The coursework can be completed in 2 to 5 years. It depends what you select. If you select a full-time program, it can be completed in 2 years. But if you go for a part-time curriculum, you have to finish it before 5 years. So that is a flexibility provided in the United States while pursuing a public health program. So the question is, what educational background is needed for public health? So when we look at the people who have done public health or who are doing public health, mostly you see people from backgrounds such as medicine, who have done MBBS or dentistry or physiotherapy Ayurvedic, nutrition, occupational therapy. So, but then it is not necessary that you should be from all these backgrounds. If you are from other sciences, then also you can pursue public health. But having taken education or training in healthcare field can improve your chances of getting accepted to the program. But then it is always better to go to the university website and look at the requirements. And if you feel that am I should I be applying here, or am I fitting into this program or not? So just go to the section where there is information about the program coordinator or program manager, and you can just email them with your credentials. They will ask you some questions, ask you for some documents, and they will look at them, and they will let you know that yes, can you go for the program, or you need to show some other things in order to pursue the program at that university. But then, yeah, I will say most of the times you can go ahead and pursue public health program. So bachelor's degree or equivalent from accredited college or university, or show evidence of strong academic achievement and scholarship. So this is like a standard requirement they have, but it's not like there is a particular criteria or marks you require to pursue it. It's not that. You can apply for it, and they see that why you want to apply for it. So there are other things like you want to tell them through your statement of purpose, through your other documents, that how you are suitable for this thing and why you want to pursue it. So, but then at the end, you have to check university guidelines and requirements, and then you can go ahead. So for the next thing, I will hand over it to Nimisha, and Nimisha will tell you about the other things.
Sorry. So while selecting a university, we usually have a tendency to go to university websites, like type in Google and search for universities that we have heard about and that we know people are studying at, or we have come across someone in some article or something. But there is a website, there is a site called SOFAS. It is a centralized application service actually, but it provides information on all the programs that are available, on most of the programs that are available in the universities across United States. So this is used by many of the accredited schools. So whenever you are looking at universities on SOFAS, you are sure that the school is accredited. And the programs of public health in the United States are very well explained in this SOFAS website. And it also allows the prospective students to apply for multiple applications at one time. So that is the main purpose of this website. But it also gives you university's detail. It will also give you link to the university's website that you can access for more detail about the program coordinators, and if you want to know anything more about the university. It can also tell you about the fee requirement, the fees of the program, and for how many years the program is, like all those details it will tell you. So there are some links in our presentation. We will share it later on, and they might appear in the description of the YouTube video. So mostly the US university requirements can vary between universities and also between different MPH programs within the same university. So it is required for you to access SOFA's website and look at these things in look at all the details, because there it will tell you if the program is STEM or not. So epidemiology is basically a STEM program in almost all the universities, but sometimes the other programs may or may not be STEM. So that is upon the universities how they get it, how they design their curriculum to make it a STEM program. So it differs based on universities, and you have to make sure if you want to go for a STEM program, you have to make sure that you apply to that specific program, because there is always a fees with the application, which is non-refundable. So if you apply to a non-STEM and if you wanted STEM, so that will be non-refundable. And it is always preferred to visit the official website of the university after you have decided which university you want to, which universities will be your options for applying. So visit the official websites, and you will see all the deadlines and all on the SOPAs as well as on the university websites. And it is very necessary to plan ahead of time. So the applications, they have span. So maybe they'll start in August and end in December. So that is a big span, but you cannot start in August and just think that it will get over soon, because there are so many documents that you have to produce, that you have to attach to your application. Different universities might also require some additional documents. You also have to give them some other things that I'll cover in the following slides. So you have to plan ahead of time before you start applying for the universities. So these are the things that you will require when you start applying. If you have a bachelor's degree, you have to, it should be from a recognized institution, and the university should be able to give you official transcripts of whatever courses you have taken from the university. So these transcripts that you get, they will show the grades that you have received, but sometimes, actually most of the times, Indian institutions, they do not provide a GPA that is acceptable in the US education system. So for public health courses, we are supposed to do a WES evaluation. So this is there is this link where you can go and just calculate your GPA according to the marks that you have scored in your undergraduate, and the university requirements will be like, they'll tell you that you cannot have GPA less than 3. So if you calculate it beforehand, then you know that you cannot apply to this university. But of course, the final GPA will be, the official GPA will be told to you after you get the WES evaluation done of your transcripts that you receive from your undergraduate or graduate universities in India. Then you will need letters of recommendation from whoever you've worked with, your professors under whom you have studied, so that they can tell them about your academic abilities and about your work ethics, how professional you are, how you are encouraged to pursue the MPH program. And then always there is the statement of purpose. This is required for all the applications, and it will provide you with an opportunity to express to the universities how you are interested and what got you interested. So you can just start writing that down from like way before you start applying, because that has to go, it cannot get done in one day. You have to keep on revising it for it to get better and better. Next is you should have a resume or a CV. A detailed resume or CV is usually required, and it should highlight your education, work experience, research, and whatever relevant achievements you have with respect to which program you are applying to, you can highlight that. And this is a good resource of resumes and cover letters by Harvard University, that most of the people in public health field, they follow that pattern or template. So we can share the link of this too. And then some universities will require GRE scores, but this will be described in their description of their program. It might also vary from program to program within one university. So you have to look at that, and because this is an examination, you have to prepare for that, and again you have to plan well ahead of time if you want to apply to that particular university. Then there are English language proficiency tests like TOEFL and IELTS. For St. Louis University, they needed us to give them IELTS score. So we utilized this resource of free IELTS training videos. We can share this link too. And this also takes some time in preparation. So Yes. And then some colleges may ask you for an interview. So they might want to know more about you. They might not feel that they have known enough from the application that you've done. So they might just want to have a general interview. They won't ask you much details about what is epidemiology or what is public health. They might just ask you for an overview of what you know about what you want to apply for. And then, yes, there is application fee for all these applications, which is non-refundable. So what skills will you learn in public health, especially from the STEM programs? So in epidemiology, you will learn how to identify the risk factors that determine the health of populations. You will know how to design and conduct epidemiological studies so that once you perform those studies, once you get the results, you can decide on how to prevent certain diseases from happening or how to intervene the transmission of the diseases. Then you will that will be possible by analyzing and interpreting the health data. So you will be learning about statistical tools. So we've learned about SPSS and SAS. There are universities that provide training in other statistical tools like R, SQL, Stata, and so on. Then you will also learn biostatistical tools since you are learning the statistical analysis part. And you will also learn something about health policy and management. That will be a little a basic overview of what health policy and how health management is done. So you will learn about that, and you will learn how to advocate for something. If you think that a health policy is not getting implemented properly, or if it requires some revisions, then a public health program usually teaches you some basics of how to do a policy analysis and how to advocate for changes in the policy. So overall, it will improve your skills of community engagement. That is very much important when you are going to pursue public health. So community engagement skills will be improved once you get into a public health course, and once you participate in all the requirements of the university, and also once you volunteer with some of the organizations that are public health based. So it will improve your community engagement. Obviously, it will improve your leadership skills since you are getting in touch with people, you are working on a team. It will also improve your communication skills. And that is like an overall development of a person when you pursue public health. And this is like a solid foundation for addressing public health challenges, because you have to make informed decisions to improve the health, and you have to rely on your education in public health for doing that. So what are the career options in the US after an MPH or after an MS program in public health? There is a wide variety of career options that you have, and these all are very interesting. We will look at them in the next slide. But there are specific paths that will depend on your interests and the specialization that you have done and the skills that you acquired during your studies. But it also depends on various other factors. So it is not like restricted to one field. Like if you've studied epidemiology, you are supposed to work only as an epidemiologist. So you will have lots of options. Then there is one option to pursue PhD, which we are also thinking of after some years of gaining work experience. So pursuing PhD after a master's or a DRPH is what some people opt for. And PhD is a funded program, and postdoctoral fellowships can be done after a PhD, which are also paid, and they involve research. And after a PhD, you can get into academics, or you can also work as a public health professional in any institutes, whether they are government or non-government. So that means PhD professionals they are not restricted again to academics. They can also work in the practical settings. So as an epidemiologist, you will study the patterns, causes, and effects of the disease. So this is all again what Apurva said. So there is another option of becoming a health educator, which promotes the health behaviors and provides information to health individuals about and the communities to make informed decisions on their health. Then biostatisticians who analyze the healthcare data, health policy analyst who propose the revisions in health policies and who do the advocacy. There is an option of public health consultant where you can provide your expertise that you have gained during your MPH or MS program and guide organizations, non-government organizations into developing healthcare strategies and interventions. There are health service managers, environmental health specialist, public health communication specialist, occupational health safety specialist. And these are just a few. There are like multiple options that you will have after graduating as an MPH. There is a program evaluator opportunities. Yeah. And this is what we saw on an online source. It is a standard online source of how much earnings public health graduates do in USA. So for an entry level, it is a range of $45,000 US, $65,000 US, and so on. So, and for PhDs, there is an approximate stipend. And for postdoctoral fellowships also, the range that is given, it is approximate, but for a PhD, it varies from $20,000 per year to $35,000 US per year. And for a postdoctoral candidate, since they've already done their PhD, the range starts from $40,000 to $70,000. But this is for gaining experience. So after you are done with this, you obviously are entitled for more payment. So coming to the last few slides of our presentation, I would like to summarize of our experience of getting educated in the United States. So it was a very different experience from what I personally had in India. In the United States, they have a very holistic approach towards education. They want you to learn different skills, not only academic skills, but also communication skills, written and verbal communication. Then we have some recreation that goes on during the semester. So you are not loaded with only academics. You are also developing overall in different areas. So that aspect of education I liked personally. And you also have opportunities that are personalized to yourself, like according to your interests. You get to mingle with people who are of similar interests. You can look for different opportunities or different organizations that match your interest. So there are a lot of opportunities like that. And the universities, the career counselors at the universities, they help to get what your interest is in, and they help you with accessing these opportunities. So that was one thing that I liked a lot. The next thing is the universities or the institutes are very much inclusive. So they are very much inclusive of the international students. So you won't feel that you are from a different country studying here in a different country, and with people from, so you will have people from various educational backgrounds, also various cultural backgrounds. So and everyone's opinions are respected and their opinions matter. So I like that thing, that the universities are inclusive. And I personally saw that there was an increased cultural competency in me. That is, what a cultural competency means is, if someone's culture is different from mine, I try to know what their culture is, and I try to respect their culture, and that improves the cultural competency. And when we work as teams later on, after graduating, we know that we have to be culturally competent, and that is how we can all work as a team towards a common goal. So working as research assistant or as graduate assistant at the university, this thing of cultural competency improved in me. And of course, the communication and communication skills, like the verbal skills and the written skills, they always want you to communicate by an email rather than talking to them. So the written communication skills improve likewise. And what I saw personally was that English fluency is not considered very important because it is not proportional to the knowledge that you have. So even though you have English that is not fluent, you can express what ideas you have, and that is very much respected and valued for. And because we are involved in so many different things, involved in engaging with communities, in talking to public health leaders, we also inculcate those leadership skills while studying public health in the United States. And from this process, I have learned to manage my time very well, because I don't know how well I manage my time in India, but here everyone wants you to be on time. They set deadlines for their work. So time management is a very important skill that I learned here. I learned how to manage my finances. So before applying for Master of Public Health, I had to gather finances in India. I was working as a fellow. So I used those finances. I borrowed a student loan. And when I came here to US, I learned how to manage my finances, because it is a different country and the cost of living is different. So you have to know how much you're going to spend and how much you're going to save from that. So that automatically will improve your skills of managing finances. And yes, and making informed decisions is very important, that I learned from this process. So I used to go to the websites of different universities to know what their programs are like and whether it will interest me, whether I will fit into that program. And this helped me in making informed decisions and talking to people who are from public health background, knowing their experiences. I did not have a mentor as such, but then talking to people, different people, asking them different questions, and knowing what their thoughts are, that helped me to make my decisions. And it helped me to trust my decisions. So from this process, I learned that trusting my decisions is very much important, rather than regretting on what decision I made, because I made it with all the information I had. Another thing that I learned is not to underestimate my potential. So back in India, sometimes I faced discrimination based on the caste background that most of us experience in educational or educational institutes or at workplaces. But here I learned that I should not underestimate my potential, because I could reach my greatest potential here while studying at the university. I could get involved in discussions, and my views about the discussions that we did, that was valued. And that is why it helped me improve my confidence. Also, this process is a little bit long. So I had the patience to wait for that long. It took us like 1.5 to 2 years to get through the entire process. So that improved the patience that I had. And also it allowed me to be considerate of myself. So as I was working as a fellow in India, there was a lot of workload. I had to do multiple things at one time. And then after coming here, me and Apurva, we had to manage things differently than the people who are from America or who are from a different economic background. So we had to manage things differently. We had to take greater efforts. So it is very important for being considerate to ourselves. And that is one thing I would like to share with you also, that be considerate of yourselves while you are trying to improvise on whatever you are doing. But it is also important to value yourself. Yes. And thank you very much for attending this session. And if you have any questions for us, please let us know in the chat, or if you can unmute. Oh, no, I think you'll have to ask us in the chat. Thank you.
Yes. Thank you, ma'am. Thank you, sir. तो जो भी क्वेश्चंस होंगे हमारे पार्टिसिपेंट्स के, वो आप चैट बॉक्स में पूछ सकते हैं, और जो भी यूट्यूब व्यूअर्स हैं वो कमेंट सेक्शन में डाल सकते हैं क्वेश्चंस. So we will have 4 to 5 minutes. कोई भी क्वेश्चन है आपके मन में पब्लिक हेल्थ से रिलेटेड, आप पूछ सकते हैं. There is one question.
Okay, I see one question. So the question is, do graduating from pharmacy background, is it considered for public health studies? So yes, it is considered for public health studies. And you should go to the websites or to the SOFA's website and look for the requirements if they require something else from you. But I don't think they will require anything more from a pharmacy graduate also. Pharmacy is a very good field to be considered in public health studies, but you have to, while you are writing your SOP, that is the statement of purpose, and while you are making your resume, you should include such things that will be more inclined towards public health, like what you did in your pharmacy that was inclined towards public health, what got you interested, because pharmacy is a different field than public health. But you have to just convince them about how it will help you in pursuing public health studies. Thank you for the question. So the another question is there any scholarship that will fund me fully? So there are scholarships. There is the NOS, National Overseas Scholarship. But as far as I know, because I did not apply for the scholarship, because when we were applying for the courses, it did not provide a scholarship for MPH program particularly. There is an NOS scholarship, and that is offered to students who gain admission in MS in biostatistics, or an MPH in biostatistics, or an MS in epidemiology also, I think. But you will have to go through that document to know better. I know one person who has secured NOS scholarship for MS in biostatistics.
Also there are some scholarships which are provided by universities. Most of the times they are partially fund your tuition fee. Sometimes they give full waiver also. As per my information, I know one of my friends. He was doing his MPH from a university in Georgia. So his program was fully funded, but then it was non-STEM. It was an MPH program, but it was non-STEM. So yeah, it depends. Sometimes universities provide some scholarship, and then there are scholarships given by Maharashtra state government, or the uh, the central government also. But then you have to look in detail if you fulfill the criteria. And yeah, like there are people who have got those scholarships, so you can look for it. And even after that, if you don't get any scholarship, you are getting a partial scholarship from the university. uh, you can go for student loans, where after started earning, you can pay you can pay back those loans in like a period of 1 to 2 years. So that way you can take an education in public health field. Then there is a question that, okay.
So I also actually I did not get any scholarship from the government, because MPH was not listed as one of the programs. So I had some money saved from my fellowship, and I utilized that to get a student loan from, there are Prodigy Finance and Empower Finance, and some companies like that who provide loan without a collateral or without a cosigner. So I got a loan from Prodigy Finance, and it gives a good amount of time, as Apurva said, to pay back the loan. So once you start earning in United States, you can pay back the loan in installments, and that won't be a problem. But yeah, that is also a good option to get a student loan without a collateral. Only thing is it will have higher interest rate. So that is understood.
So yeah, So the next question asked by Praful is scope and salary for MPH in India. So Praful, I am not very much sure about the scope and salary for MPH in India, but then I know that there are government institutions like ICMR, and then there is an institution called sure about the Indian scenario, but then I will have to do some research for that. Then there is question from Pibir that can we pursue MPH after nursing course? Yes, nursing course. Yes, you can pursue MPH after nursing course. Definitely you can pursue. There are many people who are pursuing MPH program after doing nursing course, and yeah, they're doing well. Then a question by Mahesh. Graduation in humanities and masters in MPH from TIS. Is there any chance of getting into masters in MPH in USA? You can definitely get into masters in MPH in USA, but then you have to convince them through your statement of purpose, and while also going through the visa process, that why you want to pursue another masters in USA. So you have to find out a masters which will improve your knowledge or improve your skills, what you already have, like you will gain something in addition to that. So you have to if I would have to suggest, I would have suggested you that go for an MS program which is focusing on a particular field like epidemiology, a research based MS program. So that way you can convince them that yes, I have this background and I want to pursue a master's program where I can use my skills, and also I can gain some experience in research. Then by Saurabh, there is a question that is there any lottery system in USA visa like H1B? I've heard about this thing, but then I am not very sure. I don't have a lot of information about this, so I won't be able to answer about this question. Then there masters in hospital administration and hospital management. So yeah, this is also another program. It's a similar program, but it is confined to an organization. Like if you are working in organization, you will be dealing with the administration of that organization. So see, I don't know much about it, but I can say that it's a good program, and if someone is from health background, they can think of going to this program also. It's like a MBA in hospital management. So yeah, it's a I can't say how good it is, but this is also one of the options which you can be looking for if you are from a healthcare background. I answered that question. Okay, so the next question is, what is the upper age limit for PG fellowship? PG fellowship. I think I will let Nimisha answer this question.
So what kind of PG fellowship are you talking about, like in India or in United States? And can you please elaborate on that? Because I have not heard about any upper age limit for a PG fellowship in India. Okay, the next question is, I think we missed this question. I'm doing MPH SE from TIS. I wish to have a job in epidemiology.
Yeah.
Job in epidemiology. How should be the approach to get a job there? Do you want to answer?
So, yeah. So someone, I can't see the question, but then I heard the question that someone has done MPH from TIS and they want to apply for jobs in United States. So I can tell you a, a sure thing, but then from what uh, the things I have got to know from people is that if you have done some masters in India and you are applying for job in the US, so it's very difficult to get a job directly. So rather than if you have done MPH, so you can go for some research opportunities. Like you can connect with the professors of the university who are doing research, and you can ask them that can I work under you as a research assistant. That is also a very difficult or a very far possibility. Best thing which I can tell you is you can connect with a professor and you can apply for PhD. If you get into PhD, then it will pay you some money, and you will also be doing research and learning new skills. So that is the thing. But I've never heard of anyone who has done MPH from India and then he got job in the United States. uh, there are issues with visa. Like when they take you as an employee, they will have to sponsor your visa, work visa. So uh, technically we can say that yeah, that there is this is a possibility, but then it's a very rarest of possibility. So yeah, that is what I can say about it. uh, so I think I answered this question. Yeah, I think I don't see any new questions. Uh, so I think I have answered all the questions.
Mhm. Okay, so for the upper age limit for PG fellowship, you've asked for the UK. So I am not sure about UK, but we can go through some resources to find out if there is an upper age limit. Is there a way that we can get connected later on, JSG? You can like provide the students or whoever is attending with our email ID if they have any questions.
Yes,
Any
yes,
more
ma'am.
questions?
We-
And Purvesh is saying that there are some questions on YouTube as well.
यूट्यूब के क्वेश्चंस तो हमने ले लिए अभी फिलहाल, सो देयर इज नो मोर क्वेश्चंस वी हैव टेकन। एंड जो भी स्टूडेंट के और भी क्वेश्चंस हैं तो वो हम हमारे सिस्टम में रहेंगे क्वेश्चन, वो हम आपको फिर कन्वे करेंगे, ठीक है। तो फिर उसके हिसाब से फिर हम आपको कम्युनिकेट करेंगे, तो फिर उनको बताएंगे वैसे, ठीक है ना। सो आई थिंक क्वेश्चंस आर ओवर। यूट्यूब पे क्वेश्चंस ले लिए हैं मैंने। देयर आर टू क्वेश्चन, वन फ्रॉम सुमित वर एंड प्रतीक उबाले। प्रतीक उबाले's question is things to do to get scholarship. I think this questions is covered. मिस मैं लेता हूँ।
What did you say, Jesh, about scholarship?
एक मिनट मैं पोस्ट कर रहा हूँ। Okay.
Yeah, the question.
One question from YouTube.
Oh, things to get scholarship. Okay. So if you are asking about scholarship from the government of India or government of Maharashtra or any state government, so you have to go to the social welfare department, where they provide you information regarding scholarship and the eligibility criteria. So if you are fulfilling that criteria, you can go ahead and apply. And so the important thing is QS ranking of the university. So as per my knowledge, if 50 applicants apply and they have only 15 or 10 scholarships to give away, so what they will do is they will give to the 10 applicants who have got admissions in top universities. So when in securing those scholarships, you need to get an admission into universities whose QS rank is good. QS rank is a world ranking, so you can get that on the internet. So that is what about that. And then for scholarships from the universities themselves, you can contact with the program manager or program coordinator who is in contact with you during admission process. You can directly ask them that will I be getting any scholarships, any fellowships or any financial assistance from the university, because my financial condition is not that good. I'm a bit stressed on my financial front. So that way they provide some financial assistance if they have. So that is a thing you can do to get scholarship. Yeah, that is what I can say. I will be sharing my email ID. So if anyone have any question, you can reach out to me through my email. Yeah, so there is one more question. Any chance of PhD abroad when had MPH India? Yes, definitely. You can apply. You have a good chance of getting into PhD in the United States if you have done MPH in India. And if you come across any difficulty, you can connect it to us. You can get connected to us. I can provide you information what I have, and also we will try to gather some information from people who are already doing PhD and who have done masters in India. So yeah, you definitely have a good chance of securing a PhD in the United States. But it's a process you have to go through. That process you have to be consistent with it, and yeah, and that's what I can say. Oh, you are welcome, Praful. I think, yeah, that was the last question.
Yes, questions are over, I think. Yes.
Okay. Thank you so much, Jayesh. And I also want to thank Nalanda for providing us this opportunity. We are very happy to share our experiences and whatever information we have. And we will be happy to help students further also if they want any information, any help from us, whatever we will be able to, we will definitely do.
Yes, sir. Thank you, sir. Thank you, ma'am. Thank you for this wonderful session. So we will now we'll end the session now. Okay.
Okay.
Thank you.
Thank you.
Have a good night, everyone.
Have a good night.